Now, we've talked about misconceptions about weed, we've talked about its impacts, and we've talked about law and policy. And all these things are taken into account when trying to make a decision on whether to use weed and how to use it. Now, when it comes to harm, I think the natural inclination is to avoid it as much as possible, and that's natural. It's important to remember, though, that the only way to completely avoid risk or harm when it comes to weed use is abstinence or not to use it at all. That said, we do know that there are some strategies and ways that if you choose to use weed, you can enact to at least attempt to reduce the severity of harm when it comes to cannabis use. So let's talk harm reduction. In the field of substance use, harm reduction is the approach that seeks to minimize the negative impacts of substance use, both on ourselves and the people around us. It's not harm prevention, meaning that the only way to prevent harm altogether is to abstain from using substances in the first place. But we do know there are ways and strategies to minimize the potential negative impacts substance use has to self and others. It's important to keep in mind, though, that engaging in any kind of substance use is going to come with some level of risk, from personal injury while intoxicated, all the way to legal consequences depending on the substance and circumstance. The goal isn't to convince someone that it is suddenly super safe to use or to convince someone not to. The goal is to alleviate stigma, make it okay to talk about substance use, and do what we can to stay safe to the best of our ability if you choose to use. Contrary to So, with cannabis use on the rise, Fisher and his fellow associates in research conducted a review of the most relevant research on strategies to reduce the potential negative health impacts of weed use. And so, the following are suggestions and 12 key takeaways from the review of current and leading research in terms of harm reduction strategies. First and foremost, it's important to know that frequent use before late adolescence is linked to adverse impacts on your brain development, your social relationships, and your mental health. So, waiting until the body and mind has had time to develop before using cannabis is key if you choose to use. Over time, THC content in weed products, or that psychoactive component of cannabis, has increased significantly. And so choosing lower potency cannabis products, either with low THC content or a high CBD to THC ratio, can lessen some of those negative health outcomes from THC. It's also important to know that smoking cannabis has negative impacts on both your heart and lungs. And so, while any way to consume weed can have its cons, research suggests that using alternative methods can be pretty important when it comes to choosing how to consume cannabis if you want to avoid exacerbated adverse health impacts. If you do decide to smoke weed, avoid holding that smoke in your lungs or other forms of deep inhalation. The longer that smoke is present, the longer other toxic content is present as well. It's also important to note that getting weed from legal and regulated sources like dispensaries can mean having a better sense of both the potency and content of what is being consumed. Quality standards minimize the number of contaminants a cannabis product might contain. And the math is simple. How much and how often you consume weed is linked to the severity of adverse health impacts. So, it is important that if you choose to use weed, you avoid daily or near daily use, as well as be sure to limit how much cannabis you might consume at once if you choose to use, sticking to no more than once or twice a week to stay within lower risk ranges. Weed use can also impair cognitive functioning, with impacts sometimes lasting long after an individual stops. If you notice any signs of cognitive impairments, consider taking an extended break from cannabis or drastically reducing the intensity or dosage and frequency of use. We can have negative impacts on reproductive ability as well as postnatal outcomes for offspring and people who are pregnant. So, if you or someone you know is planning to conceive a child, consider abstaining from weed to reduce the risk to yourself and the infant. Using weed with other substances can magnify the negative impacts of both substances. So it's important to avoid mixing cannabis with alcohol, tobacco, or other psychoactive substances. This also applies to prescription medication. And so if you choose to use weed, be sure to talk to your doctor about the potential interaction between weed and your other prescriptions and medications. It's also important to note that cannabis use is linked to the increased risk for developing psychotic disorders like schizophrenia, mood disorders like depression, as well as other substance use disorders. It also can increase your risk of suicidality if you're experiencing depressive disorders, especially in youth and young adults that are college age. Lastly, it increases your chance for adverse health outcomes like heart disease. So, when considering whether or not someone might use cannabis and how often, it's also important to consider things like health history, especially if these things are present or run in your family. And then lastly, the more of these risk factors that are present, the greater the chance and scope of negative health impacts from weed use can be. So take some time to think about what risk factors, such as intensity of use or family history, might impact your overall health and well being. And a final note on harm reduction. Anytime cannabis is used, you're taking on some extent of risk for negative health outcomes. These are keys to reduce the extent of negative impacts. But again, the only way to avoid them altogether is through abstinence. Also, remember that frequent use over a long period of time can lead to cannabis dependence or a cannabis use disorder. If you or someone you know might be experiencing cannabis use disorder, help is available. Visit NAU counseling services for more information. And then lastly, reducing harm is not only for your own well being, but others around you. Remember to stay aware of how your actions impact others too, and avoid doing things like exposing others to smoke or driving while impaired, because it could seriously impact not just yourself, but other members of your community.